Hip, IR, pale, and rail, and this is going to be in the supine position, laying on the ground. So the goal here is remember when we assess the hip rotation or internal rotation, we're looking at that range of motion, right? When we do this setting up laying down here, you're simply laying on your back, and your foot is going to go out to the side here. Now, the great thing about this position is you can make this as adjustable as possible with whatever your hip is giving you. So our goal here is to find a stretch more in the bottom side hip here. We're trying to avoid closing angle pain on the top side of the hip. So when we're doing this, when we're setting up, you do not have to go super deep out here to find a stretch. A lot of times going simply, in a slight range of motion here and then allowing that knee to collapse downward, inward a little bit will get the stretch we want to feel. Okay, so we're trying to feel the stretch down here, bottom side of the hip joint. From this position, we are then trying to rotate inward. So our PAIL is trying to drive the foot down and in. So I'm trying to do that motion using my hip to make that rotation occur. So I'm trying to rotate inward as best as possible. Then we're trying to go the opposite direction and trying to drive the foot up and away as best we can. That is where we will use a little more of the top side of the hip or inner part of the hip to then drive deeper into internal rotation. The key is, as always, we always stay away from pain, so we don't push into it. If we do have pain, let's say we have pain here, we can always adjust it and go inward here, foot out a little farther, whatever it may be, whatever feels best for the hip. For a lot of people, getting into this deep flexion position and then twisting or being, up here like this can really cause some closing angle pain or closing angle pinching on the top side of the hips. That's why we're laying back here. But when we're trying to rotate here, we got to make sure the bottom side of the hip, this section here, is doing that rotation to then make sure we're targeting the internal rotators of the hip and not trying to target or push into some closing angle pain or closing angle pinching of the top side here, making sure we're still getting the areas we want to and not driving through areas that are uncomfortable. Not necessarily uncomfortable as at the main point. We're not always trying to stay away from the uncomfortable feelings, but we're all trying to make sure that we push as hard as possible in a rotated position similar to the position that we actually assess. We mainly assess the hip IR in.